My name is Professor Jeffrey Lazarus from the CUNY Graduate School of Public Health and Health Policy and the Barcelona Institute for Global Health. And this is a policy contribution to the Global Metabolic Health Roundtable series, in which we're focusing on addressing the public health threat of MASLD and MASH, as well as other major NCDs. And this is being presented at our virtual roundtables in Asia, Latin America, and the Middle East and North Africa. Now, the field has a research and action agenda to address steatotic liver disease, and this was developed with a Delphi methodology over 2 rounds. And you can see on the right a series of domains that go beyond just treatment and care, but also address leadership and policies. And that's really the focus of the Global Metabolic Health Roundtable series, to get policymakers to better address steatotic liver disease. So the final agenda of this research priority agenda included 28 research priorities to tackle steatotic liver disease and 29 priorities to turn the tide on steatotic liver disease. And this is important guiding agendas in the absence of any kind of action plan or strategy from the World Health Organization at the global or their regional levels. Before we met for these virtual sessions, we had a series of questions asking the more than 75 participants if they had a national action plan or strategy for any of the key comorbidities or NCDs in general. Do they address MASLD, MASH, or NAFLD, or liver fibrosis? Are there any other insights that can be gleaned? Because all of this is being done in preparation for the September 2025 United Nations General Assembly high-level meeting on NCDs, where we'll hold a side event as part of the GMHR series, together with the Healthy Livers, Healthy Lives collaboration, which brings together ASLD, ALE, Apostle, EASL, and SOLDA, and together with the ISGlobal Public Health Liver Group and a series of endorsers of leading organizations from around the world. So this UN high-level meeting on NCDs is incredibly important, because we'd like to see chronic liver disease, and specifically MASLD and MASH, on the global NCD agenda. We're well aware that the burden of MASLD and MASH poses a public health threat, and this needs to be addressed as a part of the NCD agenda and not just assumed to be a part of the NCD agenda. In other words, we need to name chronic liver disease and to name steatotic liver disease and MASLD and MASH, and look at how we can best integrate liver disease prevention and management into existing NCD frameworks. And that starts with naming the disease and then understanding how, although many of the risk factors may be the same and some of the responses may be the same, there are also key differences. But also for the populations we serve, they need to be aware that they may be at risk or even have MASLD or MASH. So the United Nations General Assembly high-level meeting, the fourth time they've met, is a critical global forum where world leaders, policymakers, and health experts will address the high and growing burden of NCDs. Some of the key messages we have are that chronic liver disease more broadly is an under-recognized NCD, affecting as many as 1.5 billion people worldwide. MASLD, which used to be known as NAFLD, is the most common cause now of chronic liver disease, may be affecting as many as 1 in 3 adults globally, and it's closely linked to obesity, type 2 diabetes, and other metabolic risk factors. And MASH has really become a silent, even epidemic, contributing to metabolic syndrome of MASLD, obesity, type 2 diabetes, and cardiovascular disease. Up to 30% of MASLD cases probably progress to MASH, the aggressive form of the disease, which increases the risk of cirrhosis, liver cancer, and liver-related deaths, as well as extrahepatic conditions. Early detection and integration into NCD frameworks are critical. Simple, cost-effective screening tools exist, but they are underutilized, and we really need primary care healthcare systems to be better equipped to identify and manage MASLD alongside diabetes, CVD, and obesity. So addressing MASLD and MASH aligns with global health equity goals. The disease disproportionately affects, in terms of numbers, low and middle income countries and vulnerable populations in high income countries, which exacerbates health inequities. Cost-effective policy options known as best buys, and even those that can be achieved within 5 years, known as quick buys, should be implemented by policymakers to address all major NCDs, and that includes MASLD and MASH. So what are our concrete recommendations? To recognize chronic liver disease, including MASLD and MASH, as a priority NCD in global and national health strategies on par with cardiovascular disease, cancer, chronic respiratory disease, diabetes, and mental illness. In other words, to go beyond the so-called Big Five NCDs. To integrate liver health screening into primary care for populations at risk, particularly people living with diabetes, obesity, and metabolic syndrome, and to promote public health strategies targeting obesity, such as unhealthy diets and sedentary lifestyles, to prevent and treat MASLD and MASH. Fourthly, we need more investment in research and epidemiologic surveillance of MASLD and MASH to inform evidence-based policy responses. And fifth, to leverage international funding and partnerships to scale liver health programs in low resource settings. So there has been a zero draft of the declaration, which is an excellent draft, but it does not mention liver disease at all, certainly not metabolic health liver disease, MASLD and MASH, which it should. And we need to work with member states to improve the zero draft to be more fit for purpose, to address all of the major NCDs. And in addition to liver health, that also includes chronic kidney disease, for example. We support the NCD Alliance's priorities for the fourth UN high-level meeting on NCDs and for the political direction. They call for accelerating implementation, for breaking down silos, and for mobilizing investments. They also call for delivering on accountability, engaging communities, but we further call on UN member states to commit to including MASLD-MASH in NCD strategies, action plans, and normative guidance, to support policies that prioritize early detection and integrated care models, and to ensure that liver health, including MASLD-MASH, as well as obesity, is recognized in future UN General Assembly high-level meetings on NCDs. So that brings us to the question for everyone listening to this, what's your next move? We think there's an important role for liver associations that you can see here on the left, but also liver specialists, and obviously everyone outside of the liver space, because we're not going to be able to do this alone. The associations are advocating, individual liver specialists are advocating for inclusion in national and international global NCD frameworks, action plans, and strategies. But without the right partnerships, we're really not making the progress we need. And given the high prevalence that I described, the economic burden, the human burden, it's really time for MASLD and MASH, steatotic liver disease more broadly, and chronic liver disease even more broadly to be included in the NCD agendas. Thank you.